Alright, on to some myths, which are all unbelievable that they're even out there, alright?
Myths is really too forgiving of a word. In reality, these are lies, straight up lies. But let's continue.
Myth number 1. Healthcare reform will ration healthcare. Wrong! Actually,
what we have what we have is rationing. First, you got the 47 million Americans who don't have insurance and can't get care. They're all rationed. Then you have patients who do have insurance, but their co-payments and deductibles are so high that they can't afford care either. They're rationed. Then you've got patients like my patient with pancreatic cancer who do have insurance, make a claim, and the insurance company rejects the claim and rations them. Healthcare reform will make that sort of thing illegal, and it'll grant access to the 47 million people who are being rationed right now. Now, countries like the United Kingdom do have rationing, which isn't as bad as it sounds. It just is like you have to wait a couple months if it's something that's not an emergency. Even so, we're not changing our system to that of the United Kingdom's or Canada's. We're reforming our own healthcare system. And you can still keep the same exact insurance you have even after healthcare reform. So forget about worrying about rationing.
myth number 2. Healthcare reform will cut benefits from Medicare to senior citizens. False! Nothing in the healthcare reform legislation is going to cut anything from Medicare for senior citizens. Actually, it'll improve Medicare for senior citizens, because right now, in their medication coverage, there's this donut hole. So after they spend the first $1,000 a year on medicines, they have to pay out of pocket $2,000 more till the coverage kicks back in to cover more of their medications. Alright? And healthcare reform legislation will eliminate this donut hole. So it'll actually be much better for senior citizens. Myth number 3. Healthcare reform will promote euthanasia. No, that's nowhere. That's completely made up. Nowhere does it say you should convince your patient to kill themselves or should convince your patient to die early. It's complete bullshit. Myth number 4. Healthcare reform will bankrupt America. Actually, what's bankrupting America is the current broken healthcare system. Over half of bankruptcies in America are due to healthcare. That's what we're trying to fix here, guys.
H.R. 3200 specifically sets caps on annual spending for healthcare and lifetime spending for healthcare to prevent people from going bankrupt from now on due to medical expenses.
So if we keep the current healthcare system, it'll cost more and more and more and create more and more and more of a deficit, more and more bankruptcies. If we change it now and we put in an investment now, it'll reduce the cost as we go forward over time, where it will cost less in the future and start to pay for itself and avoid even more bankruptcies in the future. Now is the time for change. Now is the time for reform. Myth number 5. Healthcare reform will reduce the amount of choices that I have when it comes to healthcare. No! If you want to keep what you have now, which I don't, I would rather have a better insurance plan, which costs less and covers more. If you want to keep what you have now, you can keep it. If you want to stay with the doctor you have now, you can. You know what will decrease your choices if you lose your insurance now? I changed jobs and I changed insurances, and guess what? My old doctors, none of them take my new insurance. I'm a doctor, and I can't even see my old doctors because my new insurance won't cover them. Myth number 6. Healthcare reform will put a bureaucrat between you and your doctor. No, that's exactly what we have now, where some person in an office has to review every single request that your doctor asks for you. And if you want to keep your insurance that you have now, there still will be a bureaucrat between you and your doctor. But actually, Medicare and Medicaid government-run insurance agencies only spend 3% on administrative overhead, while private insurance companies, they spend 15% on administrative overhead. Even with healthcare reform, you can keep the insurance you have now. So I don't see how that's putting some bureaucrat in Washington between you and your doctor. It's not. So let's say you're happy with your health insurance coverage. I don't want to rock the boat. Why should I want healthcare reform? I'm fine. For example, everyone over 50 needs a colonoscopy to check for colon cancer. Right now, you have to pay a co-payment with the colonoscopy, even though it's recommended, it's a must, okay? You have to get a colonoscopy, but you have to pay for part of it. Healthcare reform will try to eliminate that, okay? It'll try to be sure that everything that's recommended and preventative is covered. Also, 14,000 to 16,000 people a day lose health insurance. For example, if you lose your job, you lose your health insurance, you're screwed. It'll make things more secure, more safe in the future. Say, the unexpected happens, you lose your job, you lose insurance coverage. It'll be there to back you up for you and for your family. Even if you're happy with the insurance you have now, premiums are just going to keep rising, costs are going to keep rising, and it's going to cost more and more every year for you to have health insurance coverage. Hopefully, this will prevent the costs from rising and make a better future for us all. There's 47 million Americans out there who don't have health insurance. I feel for them. I want to help them. The government is supposed to look out for the safety of the people. Right now, health insurance is a privilege, not a right. Everyone has a right to health. Everyone should have a right to have health insurance, but that isn't the case right now. If a patient doesn't have health insurance, it's a huge deterrent from going to the doctor or going to the hospital. Because if you have to pay out of pocket, it's hundreds and hundreds of dollars, and there's no possible way you can afford it. So people just don't go. Alright? Every day I see examples of how the healthcare system is letting people down. How the system that is supposed to help people and make them healthier is causing more pain, more suffering, more death. It's tragic, it's appalling, and we gotta do something about it. And that's why I'm passionate about it. And that's why you should be too. But no! Now is the time that we have a chance to actually do something and not sit back, not be complacent, not become part of this broken system. Now is when we have to change it.
So call your senators and your representative in the House and tell them we need health care reform with a robust public option, and we need it now.
Please check out the following websites to get involved.